Okay, everybody, I want you to meet Amanda Olsen. She is a pelvic PT just like me, and she has an extra specialty, and that is in the tools and things that we use to help our patients. So welcome, Amanda.
Thank you so much for having me.
Thank you. So before we get started, gals, I want to have Amanda tell a little bit about herself and her company so you kind of understand where she's coming from. We have done another interview before, so I'll also link back to that episode as well. But yeah, if you want to share about who you are and your company.
Absolutely. I'm a pelvic health physical therapist. I've been doing this for over a decade. I just rounded the corner into 12 years in practice. And I have a company called Intimate Rose where I make tools to help empower people to manage their condition as an adjunct to working with a pelvic PT or as a means of being able to manage on their own, especially during, we're in the middle of a pandemic now, and sometimes there's other barriers to be able to come in and get the therapy you need. So the tools are meant to be both of those things and all of those things all at once.
Perfect. So if you, just for reference for our listeners, before you came along with Intimate Rose and the products that you started rolling out for us professionals to help our patients with, we didn't have the best of choices. I'm sure you'd agree. That's why you even got into this.
Yeah.
There were multiple things where it was like, this is the only option. And so you've definitely innovated this industry in a way that we desperately needed. So I would love to chat about dilators today. And this is something that pretty much I'm sure that most people have absolutely never heard of until their doctor mentions it to them. And I'm pretty sure also from my interactions with my patients that they're pretty much terrified at the concept when it's first introduced to them. And so this podcast, let's dispel any fear or anxiety about tools that we can use to help improve our quality of life, oftentimes reduce pain. But the mindset and the approach of it, we also are going to go into because I feel that there's some misinformation within the medical community sometimes, or in how they talk about using these tools that doesn't help with the fear or anxiety with them. So can you kind of describe about dilators?
Absolutely, yes. And so for the people viewing the video, you'll be able to see what I'm holding up here. But essentially, for the listeners that cannot see, dilators are a progressive set. Ours are made of really soft, really smooth medical grade silicone that progressively get larger. They start the size of my pinky, and then they each size up gets progressively larger. And the intent of a dilator is to help a woman be able to train her body, train the pelvic floor muscles, train her brain and coordination in service of pain-free penetration. And that could be penetration of using a tampon or having a medical exam or being able to be sexually active without pain. People commonly experience pain that prevents penetration after childbirth with tearing of the pelvic floor muscles and varying degrees. With hormone changes throughout life, that can be associated with stress, changes in your health, and then just natural progression as we go through the process of life. So those hormone changes often during times of low estrogen levels can lead to changes in the tissue, making them a little bit more fragile, a little bit more tender, and that can get in the way of having penetration as well. And then also cancer treatments, whether it's breast cancer, colorectal cancer, gynecological cancer, a lot of those treatments, whether it's surgical, radiation, or chemo and other medical treatment, change the health of the vagina. And so with those changes, it can make penetration really painful. So, and then vaginismus, where the pelvic floor muscles contract without the person being aware, and that creates a barrier to being able to use a tampon or have a medical exam or have sex. So I think one of the common misconceptions when they see them, because they are a cylinder, and again, keeping in mind, they start the size of my pinky pinky, but they do get progressively larger to where they look phallic sometimes, and different dilators are shaped differently. Ours are very straight, but it can be mistaken for a sexual pleasure toy, or something that's only intended for those kind of purposes. And certainly, you know, if that is a goal, somebody certainly could use it for that, but they are indeed a medical tool for medical training of the body. And so it's helpful to think about what the goals are for yourself as a person. And you're going to use the device as a means of therapy and as a means of learning how to be able to have those pain-free experiences. And so in that way, it kind of removes that kind of like naughty or sexualized, overly sexualized stigma that surrounds it. So I think that's it in a nutshell.
Yes, you did such a good job. I'm going to pause this. Okay. So that is a perfect explanation. So we really need to think of dilators, not as a big, bad, scary. It's going to be a tool that we're going to use that will help reduce our pain. Now, I think the other thing is, this is something that's very controlled, and we get to do it in the privacy of our own home. And I think that is something that's also really helpful. But what I will say, that was really good that you mentioned that, no, this isn't phallic. It's not meant for pleasure. This is really female centric. So I have a story for you. And I'm wondering if you have heard of this similar story. So I had someone approach me. It was a mother, and she said her daughter was about to be married. She had never had sex. They were waiting to be intimate until they were married. So she had this visit with her doctor, and in a different state from me, the doctor said, "So this is you," and like kind of showed up her like pinky finger. And then she pulled out probably one of the largest dilators that exist and said, "And this is your fiance." Oh. And terrified the poor girl. And so the mom came to me and said, "Can you help me out here? Maybe you can give us some more information, because my daughter's pretty much terrified at this point." And she actually compared notes with other girlfriends that were also waiting. And this was also a very similar spiel that they got from their doctor. I don't know if it was the same one. So I've also compared notes with other pelvic PTs, especially ones that maybe work with other conservative cultures. And this is also happening in their circles as well. So doesn't that scare you? As a pelvic PT, we are so worried about the comfort and the feeling of safety for our patients, and showing our young girls that we might potentially, suspect they might have extra tension. This is not what we want them to be shown, right?
No, I am mortified.
I know. And so we've got a little undoing that needs to be done within our medical community and within our culture about dilators. That, like Amanda said, this is very gradual. But I would also say that, honestly, I would recommend anyone that suspects that they need to use a dilator, they should partner with a pelvic PT when they're able to. Wouldn't you agree?
Yeah, absolutely. Because it can be one cog in an overall rehabilitative program. There are still other factors that go into reaching that goal. And that's what we do in pelvic PT.
Yes. And so, one of the, I have women that are busy moms, and they go, "Okay, well, I'll get this product, but I don't know if I have the time to use it." What are some of your tips that you suggest to busy women? Maybe it's young girls, to busy moms. What are some of the things you like to recommend to them that maybe they can feel like, okay, I actually could use this, and I could make it a part of a routine?
Absolutely. And I think that is step one right there, is routine. And my sentiment, and I think that you're in the same boat, is if you want something done, you give it to a busy person anyway. We are very good at creating time, but But also, as women, we have a hard time doing it for ourselves, right? We can carve time for anyone else, but when it comes to our needs, oftentimes that comes last. So recognizing that you have a busy schedule and that 10 minutes are going to be yours for your dilator practice. Ideally 10 to 20 per day, recognizing a need to take a day off. That could be Sunday, it could be, whatever day works best in your flow, but just allowing your body to rest. But for consistency and in order to reach your goal, the name of the game is going to be low load, long duration hold as many days as possible consecutively. And what that means is low load. We are using the dilator gently with our tissue to gently challenge our muscles and our coordination. We are not getting in there and just kind of rip a Band-Aid off, causing pain and gritting our teeth and breathing through it. We want to be using the dilator gently and in a manner that while it may be uncomfortable, we're using a breath pattern, but it's not going to break the threshold of a 2 to 4 out of 10. So that would be the low load. We're challenging the tissue in a low pain scenario. Long duration being that 10 to 20 minutes a day, and then every day if possible. During that time, we are trying to be very mindful of how our body is responding, because that's going to be the best teacher. So we're not turning on the TV. You could listen to calming music. You could be looking at calming visualizations, images of calming places like a beach or a mountain or these kinds of things. But you're working on controlling your breathing pattern to avoid getting into a fight or flight response during the dilator training, which can happen for people that have had experiences with pain or even trauma, whether it was sexual or emotional or otherwise. So we're using that breath pattern, and we are changing body positions even so that we can be training the body. A lot of times with dilators, people think about just laying on their back and using the dilator, but particularly if the goal is to have pain-free intercourse, we're recognizing that in this controlled environment, we are going to be changing body position to train our body so we can be getting into a deep squat, which is going to allow for a relaxation of the pelvic floor muscles. We can be laying on our back with legs going up the wall supported. Getting in hands and knees, that's another really open pelvic floor position that can be really beneficial to being able to relax the pelvic floor muscles and be able to use the dilator appropriately. So just keeping in mind that we are going from a controlled, static, kind of stay still environment to adding gentle and progressive body movements to get that goal met.
That's a good way to think of it, instead of just thinking only size, keeping your body in the same position, but to move around. And I like how you're talking about one of the key factors of our pelvic floor and pain is that these muscles are so linked with our fight or flight nervous system. We cannot talk about them like a bicep muscle, but just stretch it. There's so much mental focus that is needed. The breathing is essential. We are literally calming down our fight or flight nervous system specifically. And yes, if we rip off the Band-Aid, we do too much, even in the safety of our own room, in privacy, when we feel like we're in control. If we introduce a painful stimulus to muscles that are already on alert and a nervous system that's already on alert, it actually will be counterproductive.
Absolutely.
Yeah. And I like to tell patients that we're trying to bank low pain or no painful stimuli. We're trying to collect those experiences so that for many women that have had vaginismus, every time they tried to use a tampon, every time they tried to have a pelvic exam at a doctor's office, each one of those episodes was painful. And they often can vividly retell those stories because they did leave such a mark mentally for them and emotionally.
Absolutely. And that can become cyclic where it's expected the next time. And so then there's a guarding response that then creates again that that failure to have that positive experience.
What would you say for someone that maybe they have a set of dilators and maybe they've even tried the lowest set, but they are so severely in spasm or so sensitive that they feel like they can't even insert the lowest level? what would you say to work on at that point for them?
Absolutely. So in that case, you would be still practicing your breathing and still working on what I call top-down approach of using positive reinforcement and talking to yourself. I know it sounds a little bananas, talking to yourself, but that helps us keep from going into that fight or flight response, and introducing the dilator in non-threatening ways as part of a program where you're still doing pelvic floor relaxation stretches, yoga being a beautiful model for that, finding positions to where you are able to let go and relax your body and your pelvic floor and connect with it on a coordinated type training program. Similar to learning to ride a bike, it can be a relearning of learning how to drop and relax the pelvic floor on control, on command.
Mm-hmm.
Meanwhile, working on treating the dilator as a tool and training your brain to accept it as a friend. Not a friend in the friendly sense, but as a friend, as a helper.
Yeah.
And that I recommend that people do that along with the other comprehensive part of their rehabilitation program is to be using a mantra that works for them, like, I am in control, I am worthy of pain-free penetration, and this dilator is here to help me. And introducing the dilator to non-threatening parts of the body. This could be the forearm, so gently practicing feeling the silicone, and then using kind of present moment type cognitive behavioral type things, like, this dilator is purple. This dilator is touching my arm. It is purple. It is not hurting me. So in this way, we're starting to reframe how we see the dilator. Instead of something that drives pain when we try to put it in our vagina, it is touching us and it is not harmful. We can then bring it from the forearm to, say, the abdomen, and we're touching it to the abdomen, getting closer to the genital area, closer to the area that we're working on training, but still, again, in a non-threatening environment. And then from the abdomen, moving into the inner thigh and getting closer and closer until we eventually touch the vulva, which would be the outside of the vagina, not penetrating, just touching it there, using those same principles. So it's almost in a way like a graduated experiential approach to being able to work with the dilator in service of that pain-free penetration.
That's perfect. So anyone, if you're listening to this and you're like, okay, I'm going to listen to this podcast, I got those dilators, they're not working for me, this is what you want to focus on. Go back to what Amanda just was talking about, because that's brilliant. It would be extremely helpful to back up a few steps. Now, my next question is, obviously, we don't want to be trying to insert this, though it is very, very soft silicone. We don't want to insert it without any lubricant. What would be your recommendation for what type of lubricant we need, and how much do we need?
Absolutely. So generous amounts, 1 to 2 tablespoons of lubricant that can be inserted a number of ways. One, you can use a suspension syringe, like the kind that comes with baby Tylenol. You can also buy them on Amazon, and you can fill that with lubricant, and you can use it to push lubricant deep up and into the vaginal walls as a way of kind of priming the inside of the vagina, in addition to placing it on the dilator itself and around the vulvar area on the outside of the vagina. Every person has a different need for different ingredients. The one thing I will say is that silicone-based lubricants cannot be used with medical grade silicone products. So essentially, water-based lubricant would be a primary choice.
Okay.
If that doesn't work for a particular person, they could use coconut oil, avocado oil, or even an aloe-based lubricant.
So these are okay. So the oil-based is okay, just not silicone-based.
Yes, that's the only
Okay.
no-no, really.
Okay, that definitely is important. Because
It will interfere. Those two somehow, it's like versus like, those two just don't get along, and the silicone-based lubricants will degrade the medical grade silicone.
Okay, we do not want to, we don't want that. So we've got our lubricant. In terms of purchasing dilators, you've got 2 different size sets, correct?
There are 3. There's this small A large, which would be the small, would be the smallest four. The large would be the largest four. They could buy them in either those or a medium set, which is sizes 3 through 6. And then you
Okay.
can also buy them individually too. We sell them individually on our website.
Okay.
But if you wanted kits of 4, yeah.
Okay. And then we're focusing on dilators, but you also have a wand that is brilliantly designed. It is so much better, in my personal opinion, than the other wand that the only one I knew that was available. I just really like this. It just is much more convenient and ergonomic.
Yes.
So the wand is kind of the size I always have like my index finger. So the pinky is the smallest size of your wand, right? Or
Yeah.
would you say the
I have small hands, so it is,
you
yeah,
do?
it's a little bigger than my pinky, probably about the size of my index finger with tiny person hands.
Yeah, so with this wand, there are 2 sizes.
Mm-hmm.
You could kind of treat like a dilator with this wand, because there's one side that's smaller, and then the other size, what would you say it's closer to?
About the size of my thumb.
And your thumbs are small, because I'm like, it's not that much bigger than like middle finger. Yeah, they're small. Yeah. But there's that too. And then we've got techniques that we can use. Our wand, if someone's confused about what they should get at first, definitely talk to your therapist. But yes, when we're focusing on gradually helping our body accept a larger size or more volume to penetrate, the dilators is how we can progress and do that, correct?
Yes, absolutely.
Good. Now, should someone expect to have pain, or, a lot of times when they experience their pain, it will radiate into their lower abdomen. Should we expect to have residual pain after a session of dilator use?
It certainly can happen. Yeah, I will say this. I've been the patient on the table. I created the products because I have had experiences with pelvic pain and even had surgery last year and had to go back through the dilator process. And I am a person, and roughly 50% of other women are like this, that do experience some cramping and some residual soreness afterwards, just like if you had a hard workout. Every person's tolerance for that and the degrees of that are vast. There are so many different experiences with that. So I would say you can decrease your time spent dilating. You can go for a walk, do some stretching, get exercise, do movements that bring you joy to help bring that back down. If you have made contact with your cervix, if you have a cervix within your vaginal vault, you've not had a hysterectomy or other surgeries, and you do make a lot of contact with the end of that cervix, that can result in some cramping. And so angling the dilator down and around can be really, really beneficial for that reason. And so there's different techniques that you can employ, different body positions and such that will help to reduce that. Should not be expecting to respond so much to where you can't get out of bed or you're having trouble moving. That would be indicative that perhaps you push too far or your body just needs a more gentle progression, a few minutes per day, those kinds of things.
Okay. So yeah, for sure, it's not mind over matter when it comes to dilators. We really have to check in and tune in to our body and respect our pelvic floor. I always say we have to have reverence for it.
Yeah.
If that makes sense. Just we have to respect how our body is, responding to this. Yeah.
Absolutely. And giving yourself grace.
Yes. There's so many overachievers out there.
I'm going to go from 1 to 4 in 3 weeks.
So, yeah. And so what would you say? I mean, gosh, there's such a high variability for women with this. So I really can't say that there is a certain set time, but have you found that there is some kind of general average, or what should someone shoot for in progressing from one size to another?
Yeah, my experience with my patients and with our customers has been that the first couple of sizes take longer to progress from one to the other and are generally harder. And that is because that is the big learning curve of the brain and the pelvic floor learning how to communicate together to create that drop and relax. And it's a big, steep learning curve. And so during this initial process, as you're learning and going through those initial sizes, it can take anywhere from 1 week to 6 weeks to go from one dilator to the next. I know that's not what anyone wants to hear, but sometimes the body simply needs time, and especially if they've had cancer and there is scarring and injury from radiation, that tissue needs time. After that, that learning curve speeds up quite a bit. The body learns how to relax on command, as we talked about. That process goes a little bit faster. We're starting to get some better blood flow because we've gone through this dilating process for a little bit longer. So that tends to be the common curve, but there can be points where people plateau, just like any other fitness level, stretching, running. It's a physiological process. So those plateaus occur, and you might be on level 5 for a couple weeks longer than you want it to be, and you hang in there and you give yourself grace, and there you go. Then you go and you progress to the next one.
So true. There's so many times in working with patients where I feel like we have hit that plateau. I'm getting a little stressed for them that they're going to give up on themselves, or they're just going to hit a point where they're like, I'm so frustrated. And then all of a sudden, that next visit, they just turn a corner. And I can't predict when it happens, but it just happens. And honestly, any patient I've worked with and that we've stuck together, we get them where they want to be. I've honestly not had patients that don't make progress. It's easy to feel in the short term when you're in the thick of it and you're working through this stuff that often people will think, well, it's just my body. I'm not meant to heal. They'll say these things, and because they've not themselves gone over this hill, they've not been to the other side and been able to look back yet and go, look how far I've come. So to anyone struggling with this, I would say, stick with it. Like Amanda said, give yourself grace, because it's going to happen. We're going to get you there. Definitely work with a pelvic PT if you're finding that you're hitting a plateau or a wall, and you're going, okay, got these dilators, I'm going to do it on my own. I'm terrified to go talk to someone about this. But if you are hitting that wall, let someone help and guide you as well. And then it sounds like you've got a really big network. If anyone's not in my neck of the woods, the Portland, Vancouver area, I'm not even sure if you're actually seeing patients right now, Amanda.
On a very limited basis.
Okay. But I think that you have quite a large network, and so do I, in terms of our world of pelvic physical therapists around the country. And often we know people in other countries as well.
Yep, you got it.
Yeah. And through your website, you have videos that you host on YouTube that talk about all these things, correct?
Yes, we have them on our website and on YouTube. You can subscribe to YouTube, and then there's over 100 different videos and blog posts and guides on pretty much any topic related to pelvic health under the sun.
Yes.
So those are meant to be resources. It's meant to help provide solutions and guidance.
Exactly. And I think any one of us that have come into this world of pelvic health, we've quickly figured out that there's a lot to being learned in our culture, from our medical providers and just regular people. It was shocking when I got into this field how little people talked about pelvic health and how little people knew. And so we have to take on that torch as educators with things like this podcast, you with your YouTube channel. If you look, you're going to find many pelvic PTs like us that are trying to help. So any other words of advice to people that are struggling with things? And this again can be things like you might have been told you have vaginismus, vaginal atrophy, you're struggling after radiation treatment, you've had some pelvic floor trauma of some kind, it could be childbirth. What would be any other words of wisdom that you have?
I would say there is hope. These are all completely fixable conditions. They take time, but you will get there. Find a primary care provider or gynecological provider that listens to you, and then find a pelvic PT that is a good therapeutic match for you, and you're gonna get there. So don't stop. Don't lose hope. Just keep going, and you don't have to put up with pain.
No, exactly. And girls, if you found this podcast and you think that there's very few of you, guess again.
Yeah.
There are many. It's just not something that we talk about in the open within our social circles very often, but as pelvic health providers, we see this a lot. Yeah. Well, thank you so much, Amanda. I love all the wisdom and knowledge that you have, and thank you for sharing and showing us this amazing product, which this is exactly what I recommend to my patients. So interviewing you, sharing you with my patients and community is perfect.
Thank you so much for having me. It's always so good to see you. I can't wait until I can hug you and see you again in person.
I know. I know. But thank you again. And I'm sure I'm going to have you on soon. If you guys need to ask Amanda any questions, I'm going to have the show notes or the information to how to reach Amanda on my show notes. I'm actually going to post the video for this interview on the show notes as well, because Amanda held up some of the products if you were listening to the podcast. But yes, we are going to have resources for you. So go ahead and go to pinnaclewt.com and we'll see you there. Thank you, Amanda.
Thank you.